Morning, ladies and gentlemen. This is like Madonna now. Madonna microphone. I think Madonna has many helpers to put it on. Okay, I will do that. So my name is Timo Aronkytö. I'm the, if you put the first slide there from the, it's very cold. Luckily, you could park, I could park next to the building, so I just walked about 10 meters in. And so, do I have like 1 hour? It's a long time, and I must say that after you have been hearing technology, many fancy things, and now you will hear some bureaucrat talking about money, about organizations, and something about people getting old, and something how we could do to help our citizens better when people are old. But I take the privilege to talk a bit wider, and I try not to bore you, but I'm sure that I will bore you at some stage, but I try not to bore you because I can talk about our organizations and money and decision making and so on very long time, but I try to be a bit more creative today and tell you about how we cope with things here in Vantaa and in Finland. I'm actually a health director, chief physician, but about 1.5 years ago or 2 years ago, I was appointed to this job. And now my main job is elderly and disabled, more social care than health care. And one thing which is very important is to integrate. And a couple of things about that later. But integration is now in everywhere. Mm-hmm. It's an invention of Europe, but it will be spreading all around. I think Finland, Sweden, Norway, maybe Britain, UK invented it at the same time. But integration, about after 100 years, elderly people's care is different than it's today. And of course technology, all these intelligent gadgets are more used and they help, but there are other things as well, more psychological, more cultural things. A couple of words maybe about that. So now comes the, oh this like it's here. Now comes the boring part of it. Maybe somebody told you already about this. Can I see it here? Because does anybody know how I can see it from the picture here? This one here, technology. Then I can read that, because otherwise I have to read there. I could watch you at the same time. But I can see this here, this, yeah. So I won't bore you with these Vantaa details for a long time, but I, of course, because I'm the employer of Vantaa city and we are very proud of our city, we have to say that we are older than Helsinki, which is the capital, and Vantaa has got the only international airport in Finland. Maybe they arrived through that. And I'm responsible for the elderly and health services or disabled services of 210,000 people about. A couple of words that later. Fourth biggest city, logistics center. I go this very fast because I won't bore you with these, because maybe you have heard about this. All roads go to or lead to Vantaa. This is the map of our metropolitan area, and you can see that Vantaa is like a roof of that Helsinki. And about our organizations, what does it say? Do not show this message again. In Finland, like in Nordic countries, communities, local governments are responsible for many services. This sketch is just to show you the variety of services. Health and social, education, land use, building, environment department, group and citizen services department. Practically all community services are provided by local governments a couple of words that later. And then there's the mayor, then there's the city executive board, and the highest decision makers, the city council. This is about the same than in other Nordic countries, except that you have got this provisional middle layer as well, which we are actually now planning to establish in Finland. Health and social department, our budget is about 650 million euros. And the decision-making board is Health and Social Committee. Then we have our own organization, about 3,000 people working, and then we purchase services. About half of our services are purchased from private sector or from specialized care from hospital district. Hospital districts in Finland are owned by the municipalities. And if you look, our specialized care costs 210 million, the whole budget is 630 million, so 1/3 of the services about is specialized care. If you compare this to UK, it's about 20–30% higher than in UK. It's about the same level than in Norway, Sweden, Denmark, but it's about 20% higher level of specialized services. So specialized services in UK are provided more by the primary services level. We have got family services, services for elderly and disabled, health services, and oral services. Services for elderly and disabled, 174 million. You can see that the budget of elderly people's, disabled people's services is the biggest in that sense. It's nearly as big as specialized care. So the pressure for increased demand is with these elderly people services. Not so much oral or family services, but elderly people services. A couple of words later. So it's me, and we have organized our provision of services so that we have got services for disabled. It's a block. These are disabled people who have been from after their birth they have been disabled. We have got about 1,200 disabled people in Vantaa. Then we have got outpatient services for the elderly, about 5,000 customers. 5,000 people living at home during the year get our services. Then we have hospital services, 250 beds. This is only rehabilitation. We buy about 350 beds from the specialized care. 350 beds from the specialized care, 250 beds elderly people's rehabilitation. Then we have supported housing services. This is this 24/7 nursery homes. I will focus on these nursery homes and then outpatient services after a while. We provide 1,150 nursery homes at the moment. 70% is purchased from private sector, 350, 400 we provide ourselves in our own establishments. So it's 70-30. I know in some communities in Nordic countries you have only own production, or then we have communities which is only purchased. But in Vantaa it's 70 purchased, 30 provided by ourselves. Let's not go that. This was into more details, that one. This is how we serve elderly Vantaa citizens, residents. We have got rehabilitation hospital, one own hospital, 200 beds, assessment, acute unit, geriatric rehabilitation after surgery, after brain insult or so. Then we have got acute care wards, 52, which are along the specialized hospital, Peijo's hospital, which is part of the university hospital, 52 beds. And then we have Kauniala Hospital, which is a tertiary hospital, and it was purchased by Vantaa City a few years ago. And it used to be Veterans Hospital, and now it's been changed into this geriatric rehabilitation. We have got 4 elderly people centers, senior citizen centers, nursing home, 10 service homes, which are like not 24/7, 5 activity centers for mentally disabled, active council for the elderly and disabled. This is very important to get these people involved. We have got disabled people committee, council, and then we have got elderly people. It's like you have, it's the law which says that we have. Then emergency care is Peijo's. And I'm not going to talk about these health centers, which are function about the same than in your countries. And then we have, of course, social care. This was Vantaa. I will refer to these details in some places of these presentations, but now I go a little further about this, what's happening, and maybe some thinking about what we could do better. This is very interesting that I'm aging, you are aging, and the planet is aging. And world average age at the moment is about 30. I was 30 20 years ago. And now I'm 50. And if you see that I'm older than the average Japanese. Median age of Japanese is 46 at the moment, and the youngest population is in Africa, but it's not in here. Actually, there is also South Africa. South Africa there is, but Africa as whole is not here because it would be even younger. But you can see that we are aging, and in the future we cannot do things the same. And one thing is that I'm going to talk about these nursing homes and why nursing homes were invented, what will happen to nursing homes, and what nursing homes are in the future. But nursing homes were invented. There were these elderly people's proportion of the population increased very rapidly. One thing is very interesting and may refer to some what will happen in the future. This is is that the US is young. And if we think what will happen in the future, this global power proportions or power, you can see that in the US, because of the Latino population, it's quite young. There is a proportion of young people which is higher than in other countries. But 85 year, I didn't take the most oldest looking person from the internet there, because there were 85 much worse shape. This was like from the best part, but you can see that they are all 85. 85 now, 85 50 years ago, it's a completely different thing. And when I'm 85, I expect different things than my parents and grandparents expected from the services, from the society, from the fellow citizens. Some thoughts about Finland and why we are doing this healthcare reform, we are doing health and social care reform. In Finland, life expectancy varies lots. In North Finland, you really die soon. And if you are a 50-year-old guy in Helsinki South, you die sooner than if you would be 30. You live longer. If I'm now 50 and I would be 30, I would live longer. Now I live maybe 70 or something, 79. But if I were now 30, I would live 85.
And if you live in northern part of Finland, you should move to southern part.
Yeah, it helps. Also changing your language into Swedish helps. Because Swedish people tend to live longer. So, but you can see that red, it's really red where it's red. And that refers to that we have to do preventive work a lot in order to prevent people being disabled and requiring services in the future. Let's not talk about more about that, but go to Vantaa and what will, if we continue on doing things like we do at the moment, we would have 35% more of people aged more than 75. I will talk about later, or maybe I say now, why we use the 75 as a cut point, 75 years. We always, it's in the future, I think it will be 80. 75 is too young as to be a cut point for this kind of service level estimate. But in OECD countries we use at the moment 75. When you get 75, about 1/4 of the 25% of the people more than 75 have cognitive impairment, and half of that have severe or moderate cognitive impairment. So out of those 35%, 1/4 have cognitive impairment, meaning half of them needing nursing homes, if we don't have technology. And I show you some figures later. In addition to that, we have other multiple conditions, because elderly people tend not to have only one condition. They tend to have long-term multiple conditions: heart disease, stroke, respiratory condition, mental health, arrhythmias, dementia, and so on. Dementia meaning cognitive impairment. And then we have this frail syndrome. Who has heard about frail syndrome? Fragility, frail syndrome, which is now researched a lot. It means that slow muscle weakness, muscle weakness, muscle loss, slow motion, being fragile, and that is a new syndrome. And actually, it is two things: frail syndrome, 10% of the people over 75, and then cognitive impairment, 1/4 of the people. These are the two conditions which need nursing, which require nursing, and that if we invent technological solutions, then we have to focus on those two conditions. And then health inequalities, of course, because we tend to see that people who feel well, they feel even better, and people who feel bad, they feel even worse and they need more help. Then I put there, what is our challenge is lack of vision at national level, not at local government level, of course. The thing behind there is the lack of integration. It's the construction of the whole system hasn't been able to reformed as it should, maybe. And that's why we are doing this new reform, major social and health reform, in about 3 years. And then austerity, less money, efficiency demand, do more with less, and rising demands as whole. And rising demands meaning people who are not now old have got used to demand. But this austerity and efficiency demand, they of course give an opportunity for technology to replace hands, to do things more efficiently. If we don't do anything, then the need for nursing, this means sheltered home. This means this 24/7 nursing home capacity increase should be 30% in like 2020. That is like 4 years. You can see this screen, it's taxis. Taxis are about the same. So actually we don't have money for that. We don't have money for that increased 30% nursing homes. In Vantaa, it would mean 350 nursing homes in 4 years. And actually, we don't have in our budget, 4-year budget, which is now approved by the local government, it doesn't have that money. But what if the people have got this memory impairment? What happens to them? So we have to invent very quickly means that these people can stay at home. And it has to be done in 4 years. Resources, you can see per 75-year-old citizen, they actually go down. This also requires that 75 plus citizens, they have to be in a better shape. Memory impairment helps, frail syndrome helps, has to be placed in order, put into action, let's say so. This is our organization's this kind of metering table. Also, there is the national quality recommendations by the National Institute for Health and Welfare here. These, by the way, on the right are the about 10-15-year-old recommendations, and they are bullshit. And if you compare these to your communities, it's, they are not valid. But actually, the person who invented them is a friend of mine, and she said to me that they are bullshit because they are not valid anymore. The world has changed because living at home, 92%, 75 plus, it has to be higher. Already in Vantaa, it's 92.2. It's higher than the recommendations, and it has to be in 4 years 93, 94. Okay, it helps because 75 years, 75, 76, 78, they are so well off anyway. Not well off, but they are so healthy. Well off maybe also because we live in quite affluent area, southern Finland. Regular home care, this means that home nurse comes home to visit you once a week, once a day, 3 times a day. It's 13 to 14%. No, we cannot do that. Technology has to do something. Virtual home care, these all things you have in your wrist. All these safety equipment, otherwise all these things which will be invented in the future, they will help. In Vantaa it's now 9%, and I think that 10% should be, because our population, the cohort of 75 plus is also getting older, then we need 10%, but not that. Then this is informal care, support from the significant other. You know that this is like spouse nursing, friend nursing, or some or maybe a child nursing the parent. It should be like 6 to 7%, but I don't believe that that's possible. 5% maybe. Now it's 3.7. Then we have this number of beds in hospital and acute care departments. Let's not go to that because it's getting lower and lower because outpatient care is getting more common. Then we have this long-term care, nursing home, residential care, institutionalized care. Institutionalized care, meaning old hospital care. It shouldn't exist because hospital bed is not anybody's home. So 2 to 3%, I think 0 is the aim, but I think 1% may be there. Because old institutions, they just continue on being alive, even though we try to not purchase hospital care. We buy it from this Kauniala hospital, because it's a hospital which was built for veterans, and they do things a bit like the same, like a few years ago. So we still purchase something, but this is this residential care. This is long-term nursing. This is the 24/7 nursing homes. 8 to 9% in your communities. In some of your communities, you have 10%. We have got 7.6%. I think we have to lower that. People have to live at home, not in nursing homes. And yeah, let's go forward. Then the story goes. This is in Finnish partially, but look at the sketch on the left only. The grey is regular home care. This is like on the top. It's like 10%. You can see that the lowest is health center long-term inpatient. This is the old-fashioned long-term care where people are at hospital even though they should be at home. In Finland, from 2000 to 2013, it has been, you can see that it has been cut down to 1/4. Then we have these residential homes also. This is about the same. We call the residential home is old-fashioned these departments for elderly people. They are not homes either. So these two lowest are not homes. Then we have got this sheltered housing with 24-hour assistance. This is this 24/7 nursing homes. It's a product. Home, food, shelter, nursing product costs 50,000 a year. And at the moment in Finland, private sector, for example, is building lots of those, and they are making it as that kind of combined product. But I can buy that product for some over 75s, but for most 70 plus 75s, that product is not in the future anymore the thing how we should do it, because it's an old-fashioned product. A few words about that. It's a bit drastic idea, but I claim that it's an old-fashioned product. And then we have this ordinary sheltering housing. This is just rental housing, community housing, senior blocks, and senior centers where there's young people living. Then there's sheltered housing. Then there's home care, visiting, not 24/7, tailored services to home. This is what we need, and you can see it's the dark green. It's getting smaller, the amount. It should get bigger all the time. And then a home care where people live at home. So we need 2 of the utmost, and we don't need 3 of the downmost. But at the moment, this yellow or whatever, it's getting bigger because it's an easy product for communities to purchase. Too easy. And technology should be put there in dark green and in the grey. Because there is a very big demand for this easy product, and it's got dementia, moderate to severe memory impairment. In Vantaa 2020, if you say it's there, there will be about 1,000. There will be about 5,000 more. We have got 10,000, 11,000 citizens 75 plus. And 2020 we have got about 3,000 more 75 plus. Out of those, about less than 1,000 have got some kind of memory impairment, and about 300 have got this frail syndrome, and then other diseases, other illnesses on the top. So we have got 800 cognitive impairment, and out of that half are moderate to mild, moderate to severe. So we should need like 300 to 500 more of these products, and we don't have money for that. So we have to invent something else. In 4 years, we have got 4 years time. Yes.
Isn't that when you make a linear progression? You say 2040. 2040, I guess the age will be 85 or 90 plus before you see all these symptoms and symptoms of
memory impairment.
Yeah, exactly.
Yeah,
all diseases that needs care.
Yeah.
Another thing I'd like to comment on, I think the price is rather similar to the Danish prices, but if you have a break even on the home care, if you deliver 20 hours.
Yes, the break even is like in Vantaa it's about 3 to 4 home visits per day. The break even.
About 20 hours per week.
About the same, yeah. About the same, yeah.
So you have to calculate
that
too.
But if you need 20 hours, put there some technology and reduce it to 15 hours.
Probably yes, but I just I was thinking about the age and the progression.
The other syndromes, the other conditions, yes, but unfortunately there is no cure for dementia at the moment, and the medicines which are now used are very, let's say, very non-efficient at the moment. So actually, this linear curve, it will take place if there won't be any better cure for memory impairment. For some reason, human brain is like self-determined to have this memory impairment at the age of 75. And that happens to 1/4 of us. So in this 1/4 of you, when you are 75, you have memory impairment. And it doesn't matter what you do, it just happens. When my father was 80, he got it like that. When my grandmother was about 75, she got it like that. And my grandmother, I remember, was the wisest person on earth. And then, yeah, maybe. But anyway, it means that even when you have this memory impairment, you should be able to live at home. And we need that kind of housing solutions. We need that kind of technology solutions. We need that kind of nursing and services you take home. I don't go to that product. I don't want that I will be installed into that product, but because I want something else. I was talking about demanding people. And my question also is that is dementia cured at hospital? Because in Finland we try to cure it at hospital. This is because this data is about 8 years old. I didn't put the any this, but it's not anymore like that. This is hospital care due to dementia days per 1,000 citizens. In Vantaa, this is not 217. In Vantaa, it's not 217. In Vantaa, this is 30 or 40. It's difficult to estimate, but it's 30 or 40. But we have got these communities, north, east, which so-called rural communities, they haven't been able to, they haven't had the money or the energy or the knowledge to restructure their service provision system. But you can see Cyprus, okay, people are at home because the eldest daughter takes care of the dement elderly person. Then we have, which is Latvia, Itävalta, Czech, Hungary, Iceland is the best. Then Germany, Sweden, Italy, Ireland, Denmark, sorry, the best here, of course, Norway, 1.1. Yeah, everybody is at home practically, or nursing, or this kind of nursing homes. The nursing home is home here also, but I was saying that nursing home is home, but it's not the home in the future. It should be a bit different nursing home. That is my point, but we can discuss that later. But they are not in. This means that people with impairment, cognitive impairment, are not institutionalized in either a residential home or hospital, in bed, that kind of thing. What's there? But the opposite, this kind. This is actually from Denmark. This picture. This is from Finland. So, this is from Finland. So this is our nursing home. It used to be like that, and now it's like that. That this is actually, this is not 24/7 nursing home. This is different, but this on the up, it's like this nowadays. So this is the change which has happened in about 10 years, 15 years, very, very quickly. And in Finland and in your countries, it's memory impairment is cured. They live like this on the right, but still in some places in Finland they live like on the left. So 2020, how much time do I still have? Because I don't have any watch. No problem. So 2020, how we get ready for that? Integrated health and social care, also integrated housing. So, and integrated technology, digitalization, and we have to cut reduced application. And this refers what you talked about. If you need 20 hours nursing, you have to cut it. You have to do something differently. You have to put there some technological solutions, involve fellow citizens, neighbors to take care of the person, network, and cut it 10 hours. Do something differently, and so that the person can stay at home. Because it's cut resources, reduced application. Because our nurses cannot run any faster. They run at the moment maximum speed. Then focus on prevention and support self-management. This is very important. We have to try to get the whole community to put more focus on prevention. And in Vantaa we are now starting a very big effort of this home rehabilitation or rehabilitation to homes. It's home rehabilitation, actually its name is rehabilitation to homes. So it means that everybody from all the levels, from decision making to the nurses, to the home nurses, home care, has to like buy this thought of rehabilitation in everything. And actually there is lots of technological things which can be done in that area. Cut demand. Then daycare as norm, where hospital is needed, wallless hospital. The future nursing homes, I was saying that this nursing home product, it will change. But of course we have these nursing homes and there will be even more nursing homes in Finland. There has to be opportunities, that there has to be also readiness that hospital comes to the nursing homes, wallless hospital. And in Vantaa, Myyrmäki, we are building a big residential, this kind of nursing home, which is new, focus on new perspective. And there will be also hospital possibilities, distant monitoring and all kinds of things. So it would be like wallless hospital. Quality and safety. The quality and safety of nursing homes is not at the level we still require. And of course the person at the center of decisions. There is a law in Finland that nobody must stay at hospital if there is not a medical condition. There's a law for that. It's against the law. And now if I go to some hospitals in this area and look at the conditions, I must say that we don't always follow the law. There are still people living at hospital. In Vantaa, very, very few, but in other parts of Finland, yes. And the Elderly Services Act was enforced like about 2-3 years ago for that. So, am I running out of time?
No. About 15 minutes.
15 minutes, yeah. So, now one thing about this...
and then it comes some questions.
Yeah, 15 minutes, because this is actually the last topic I'm talking about. Now I come back to that product. It's a, it's a product which is in between of this institutionalized care hospital, this nursing home, 24/7 sheltered, and then there is this normal homes and home care and services to homes, technology and everything. This in this nursing 24/7 nursing homes in Finland, people live 2 years, 2-3 years. In Vantaa actually 3 years. It's a lot. In Sweden, less than 1 year.
In Denmark, 1.8.
1.8.
Yeah.
In Holland, 1.7. In Finland, 3. So you have done it. So I should actually come to learn. But actually, we have been visiting Denmark, Sweden, to learn from you. Because in Finland, so the product is so well sold to us that two healthy people go to live in those houses. So we need new structure. We need more steering of the system. But it's difficult because at the same time we have to listen to the people. We have to be person-centric. And we have to listen to their relatives, their significant others, and what they want. And it's a difficult system. It's a difficult to arrange it. But in Finland, we cannot afford this. It's not possible to afford it. We have to develop home services to homes. And because we don't have hands, we don't have nurses, then we need technology. And we don't use technology. To that extent, it should be used at the moment, not to speak about after about 4 years, 10 years. But this strikes me actually. I should talk to your steering people who steer your systems to like Sweden now and in Denmark, how you have done that. But actually, we visited Denmark with our Social and Health Committee like 1 year ago. So, home care 2.1, multidisciplinary approach, of course, you know, everybody knows that. One thing which will be essential and in the center is assessment on service needs. And when the new system, this new health and social reform is being planned, this assessment of service needs is in the center of everything. It has worked. GP assesses if person needs secondary care, hospital care. There is a GP for that. But in social and elderly people's services, there's nothing. But in Vantaa there is now. It has been 1 or 2 years. But it needs still a much more like scrutinized approach, this thing. Then tailored services, network. I was talking about this fellowman society. We need more third sector neighbors, otherwise we cannot do it. This technology, we are now introducing enterprise resource planning into Vantaa home care with a very big effort. Home rehabilitation to homes. I don't talk about that because I want to talk. I want to leave some time for questions. Then we need new management style, cultural approach. Holland has done it. There's a team responsibility, rewards for the team self-management, all kinds of things which we don't have in these bureaucratic systems. We need more of that, and I think the most rewards come from there as well. Quality, and one thing which is very close to my ideas is how we can prevent emergency admissions. I mean emergency hospital admissions, because if a elderly person goes to hospital emergency ward for 24 hours, it doesn't normally help him or her. We should be able to create an emergency system at home. It needs physicians who are courageous enough to take responsibility, but they also requires money, and we cannot change from this money from tertiary care, secondary hospital to here, because we have to pay them. They are different organizations, and now we need this new reform in order to steer this system better. It starts in one day. I can do it in the new system, but in this system I have to just pay the hospital district bills, and I cannot do it. So it's like this steering in the middle, and then this is a bit surrealistic picture because I just took all the information away because I don't want to go into details of that. But it's the idea in my mindset is like that. I'm not going to talk about this healthcare competition saves lives, because this is my claim. Healthcare competition, right kind of competition, saves lives. So a few pictures about our rehabilitation at home. Then this is like this. This is from our nursing home citizens. These are our nursing home citizens. This is River Vantaa, where there is still salmons there. Rehabilitation, very community oriented services. The people who are working there, they are really citizen oriented, and choice and self-determination in later life. I'm not going to go that. This is my last slide. you can see that Finnish people like sauna, and there's sauna in every nursing home, of course, and you can still live independent life even though you have some condition, and share. Thank you.